Hello and welcome everyone to the first live stream of co-produced care that we've had in, I think it's got to be a year since we had our last one. The last one was the CQC one where we looked at restriction and restraint and their report. And this time we're going to be looking at a long-term social care workforce plan. So I'm very excited. I'm going to have some fantastic guests who are going to be joining me. I'm very lucky. And I'm going to introduce them very, very shortly. But first, I do want to thank everyone who's listening live. Enjoy us in your lunchtime, but also make sure that your friends and your colleagues come in with you. So if you've got someone who might want to hear from our wonderful panelists, then let them know that we have gone live and that there's a fantastic live stream going on. So we are on a few channels at the moment. So we're on platform of YouTube, also on Facebook, and Twitch. But I don't think anyone even watched Twitch. I don't know, but we're there just to seem cool. But don't forget that it's really good if you can share what we do, like us, and subscribe if you're not already subscribed on YouTube. YouTube is a really great place for you to join us and subscribe. So what have we been doing? We have been busy at Co-Produce Care, doing lots of different projects, and if you want to find out more, then do visit our website. And later on in the year, in December, we've got another interview coming up with the Care Quality Commission, and as we always do, we like to bring your questions directly to them. So we'll be inviting the new interim chief of adult social care for CQC in December, on the 12th of December. We do have a time, but you'll only find the time and the link and the Eventbrite if you join our newsletter. So everything is in the description of this video. So go there or just go onto our website. Okay, enough with the introductions. I do want to encourage you to, in the comments, just write in the comments. We're talking today about what a long-term workforce plan for social care should and could look like. So whilst I'm doing a bit of an intro, put in your thoughts. Our guest speakers are going to be talking about their own ideas, also kind of reflecting on the complexities of the workforce issues that we are facing at the moment. So really, if you could try and get the conversation going and put in your thoughts, really appreciate that. Right, so I'm just going to really talk about the inspiration for this podcast, and it really came out from an announcement that was made back in June. I'm just going to play a short clip to show you what that announcement was.
Unless we act now for the long term, the challenges we face will only get worse. So today, we're announcing the most ambitious transformation in the way that we staff the NHS in its history, the long-term workforce plan. This is a 15-year plan to deliver the biggest ever expansion in the number of doctors and nurses that we train, and a plan to reform the NHS so we deliver better care in a changing world, and a plan that not only eases the pressures today, but protects this precious national institution for the long term. Okay, so I don't think I actually saw that particular clip, but I did see that they were going to do something for the NHS, and I thought, well, hold on a minute. We have a department that is called the Department for Health and Social Care. We have a minister with the title Health and Social Care, and we have a Secretary of State, same thing, but we only have a strategy for the NHS workforce. So of course, that was something that I thought was a little bit of an issue. But of course, let's see what they were thinking about in their NHS long-term plan. So I'm not going to go into it with details, in a lot of detail, because obviously we're not here to talk about the NHS long-term plan, but it's good to look at where this is starting from, because a lot of people say that the NHS long-term plan should somehow dovetail or have some connection with what happens in social care. So just looking at the chapters, They've obviously looking at a new service model. That's one of the themes, is a change in the way that the NHS is modelled. More NHS action on prevention and health inequalities, further progress on care quality and outcomes, digitally enabled care, which is very interesting. I'd love to do one on that another time, a live stream on that, and then taxpayers' investment. Obviously, I've missed one of the chapters because that's the one that was the main premise for the live stream and of course of the report as well, and it's all about staffing. So NHS staff will get the backing they need, so it says. And the titles that they're looking at are, sorry, this is a bit smaller than I wanted it to be, but I'll read it out. Firstly, a comprehensive new workforce implementation plan, expanding the number of nurses, midwives, AHPs and other staff, growing the medical workforce, international recruitment, supporting our current NHS staff. There is more detail in the report, but it's not hugely detailed. Enabling productive working, leadership and talent management and volunteers. But of course, there was a lot of criticism. I wasn't the only one who was thinking, where's social care in this? Just picking up one of those, and that's from the Nuffield Trust. And it's saying that it is a missed opportunity that we see no social care workforce plan promise alongside this. The shortages and chronic staff turnover are even more damaging than in the NHS. Thank you for that comment. I will read it out in a second. I'm just going to go through this. And the two sectors share crucial staff groups like nurses, with a constant risk of health services sucking vital workers from fragile care providers. In future, we should align the two to make sure services are keeping people well and helping them return from hospital. So that's what they were saying. I think that pretty much echoes a lot of the commentary at the time. So along comes Skills for Care, wonderful announcement earlier this last month now, the 1st of November now, and they're going to be looking at developing this workforce strategy. And of course, they highlight the issues of the increasing needs that people are going to have for care. Their figure is they're going to need 25% more posts, which works out as 440,000, and by 2035, so not too far in the future. And that's if social care grows, if it needs to basically pick up with the need for care in the population. So in responding to that need, Skills for Care, as the strategic workforce development body for adult social care in England, if you didn't know, will be working with a wide range of organisations and people who have a stake in social care to develop a workforce strategy. Now, this strategy will identify the social care workforce needed over the next 15 years. It's not really going beyond that, and set out a plan for ensuring the sector has enough of the right people with the right skills. And of course, the CEO of Skills for Care is Ona, and she points out also, I think really all I want to bring out in this is that they are focusing on attracting people, but they're also, the last bit of this sentence, recognising that all of us who will draw on care and support in the future need to be involved in this, because it basically applies to all of us. So these are all very good headline comments and initiatives. So there's not just going to be headed up by Ona, it's also going to be headed up by Sir David Pearson. Now, some of you might remember Sir David because he led the task force and was supporting the government in developing a plan for adult social care during the pandemic. And they're going to be heading up those. So his comment, this is all from Skills for Care's website, so you can look at it if you want to. He's really reiterating the need for the plan and also about the quality of care, which I think is really important. But again, saying that voices of all parties need to be involved. So making sure that everybody has their voice heard. And I think I really wanted to draw that out because we're probably going to go into a process of finding out, consultation probably about what we think needs to be in a workforce plan. And if you are ever invited to take part in that process, I would absolutely advise you to take some time to do that
for various reasons, which I think we'll come on to. So that's enough of me. I'm going to invite my guests on. Bear with me because we have a few and it's going to take me a minute to bring them into the stream. And whilst I do that, I'm just going to go round and ask everybody to introduce themselves. I think, Melanie, we can't see you. Oh, yes, excellent. And then just say a sentence about where you think the focus for a workforce plan should be. So that would be great. So I'm going to start off with James.
Thanks, Sophie. I'm James Sage. I'm the Head of Health and Social Care at RWK Goodman. We're a firm of solicitors that advise care providers. My area of expertise is around HR and employment law, and I help providers with their kind of strategic HR and employment law issues. In terms of where I think the plan should be focused, I think breaking it down between kind of recruitment and retention, I think there needs to be some solutions around increasing workforce from the domestic, increasing care workers from the domestic workforce. The government's completely failed to do that to date. And I think there needs to be a real focus around young people. Only 8% of the workforce in care are under the age of 25. And I think we need much more of a coordinated strategy led by the government between the sector and the education sector, so schools and colleges in particular, rather than what we seem to have had to date, which hasn't been a strategy, but a real focus around kind of the job centre being the kind of answer to the care sector's problems. And I know that providers generally find that quite an unhelpful strategy. I think that there needs to be less reliance on overseas workers in the kind of medium to long term, because I don't think that's sustainable given the kind of global competition for care workers, and particularly if there's increased demand from countries like America and Canada, which we haven't seen yet, but could create greater pressure for the global workforce. And I think pay, is absolutely fundamental to all of this. And I think that the only way the sector can really thrive is by having pay parity with the NHS. We've heard that. We've seen various reports saying that equivalent roles are paid about 40% less in social care than they are in the NHS. So I think that is really critical, and I think commissioning is so poor in so many different ways that it really hinders providers' ability to determine their own future success and that of their staff as well. So I think those two things are obviously kind of interlinked: the commissioning and the pay side.
Great, that was a lot in that, but thank you, James. Appreciate all of those, and maybe we'll dig into those in a bit more detail shortly. So if you're okay to go on mute for a second, I'm going to just pop over to Mark.
Yes, hi everyone, my name's Mark. I'm a regional business manager for Essex Cares. We're the largest reablement provider in the UK, but I'm also the co-founder and director at the Caring View. I agree with everything that James has just said. The only things I think it should focus on is around the career development, the pay, but also the benefits that we give our frontline staff. So many providers don't offer sick pay to our staff, but you can get that in so many other kind of walk-in jobs, as I say. But I also think government and local authorities need to do more around the shift in society's view of what social care is, because I think we all know about the NHS. We all access it so frequently, but it's not until it's kind of an emergency thing that people start to think, oh, actually, I need to get care for my mum, my dad, my loved one. And I think we need to do more around how we kind of embed that in society as a whole.
Absolutely. And I think the sick pay thing is definitely one of my bugbears, because for a long time, health and social care, but specifically, social care was one of the sectors that reported the most long COVID of any sector, and it's still a thing. And we are historically and currently still quite a bad sector in terms of providing sick pay, and also if you're thinking about health and social care and that parity. So yeah, really good points. Thank you. Geraldine, can I come to you next?
Hello, everyone. Yes, thank you. yes, I'd endorse those points raised before. Hi, I'm Jerry McMurdy. I work as a health and social care consultant for the liaison group. We support the NHS and social care organisations with addressing challenges in delivering care and support services. One of the key areas I think, and the recent report highlighted, is the extremely leaky buckets. So the retention issue, and asking the questions, but also looking at, you know, if you were going to work in the sector from, you know, and just kind of do some blue sky thinking, what would you be looking for from an employer? What would be attractive? And, you know, the Skills for Care report did point out some key things around being able to work full time, but also there's an opportunity to think more strategically about the workforce, childcare, aligning that with support for childcare, flexible working, and also we've got a huge need for people to be working in the community, supporting people in their own homes. I think the attrition rate is probably higher in home care because we have factors where we've got people working not being paid for travel and mileage, using their own cars, not even in some cases being able to have a break. So we really do need to look at ethical issues around recruitment and working practices, so that it's an enjoyable career option, and there's also progression and the opportunity to develop and progress. And employers also need to look at the issues around investing in staff and talent and supporting their staff to grow and reach their potential. There's a massive opportunity for social care to really support people who want to stay in their own homes, have obviously complex needs and are aging with maybe some complex needs. That's not going to change. In fact, it's going to increase in terms of number. So there is a real need to address that and look at investing in staff, helping them to be skilled up so they can offer really high quality care to support people to age in place and have a good quality of life. And that includes offering options for people to work as personal assistants, as well as working in organisations where they're directly employed, because there are a number of trends that, if you're looking at the workforce and looking at it in a long-term way, social care can really grasp the mettle with the right support from government.
Yes, absolutely. Thank you. And George?
Good afternoon, everybody. My name is George Appleton. I'm the head of policy at Care England. Just quickly, as I'm conscious of time, by way of background about Care England is the largest representative body of independent providers of adult social care in England. Our membership sits across single care homes, small local groups, national providers, not-for-profit providers, as well as private providers. So we have around 160 members that run and manage approximately 4,000 care services across around 120,000 care home places for a variety of individuals, ranging from those with long-term conditions to older adults to younger adults with a learning disability and autistic people. Just to bring it back to your original point, Sophie, I think the NHS plan really falls into three priority areas, which I would suggest represents a strong starting point for what the social care plan needs to focus on. The first of which being around training. So within the context of the NHS plan, this was looking through the lens of increasing education and training, as well as increasing the routes into the NHS through the likes of apprenticeships. We know that the visibility of a career in social care is not always something which is as visible as what it should be, particularly at the likes of a secondary education point of view, but also particularly in the informative years of primary education. I think we're all brought up with this conceptualization and ideology of the NHS, but no such parity exists with the social care sector. The second big theme is around retention. So the NHS plan looks to improve culture and leadership across organisations, whilst also looking to support mechanisms for current staff in terms of health and well-being within the context of social care. I'd put forward the importance of recognition and fair pay for care staff reflective of their skills and competencies, as well as commensurate with their work that they ultimately do. And finally, the last point is in relation to reform. So using the likes of new tech to improve efficiencies, as well as providing a more defined career pathway into existing roles, as well as new roles, which will take account of the likes of the changing epidemiological profile of those who draw on care and support. So within the context of social care, looking at the prospect of a rewarding career with a clear route into progression aligned with a national pay structure to ensure that staff are fairly remunerated, as well as the issue of domestic and international recruitment routes working in harmony to meet staffing needs.
Great. Thank you so much. There's a lot in that as well. I'm going to just move on very quickly to Carolina.
Thank you, Carolina, from the Careworkers Charity. I think from our point of view, the most important thing around any long-term plan for social care is around the workforce, sustainability of the workforce. Like Geraldine mentioned, retention. Retention in many ways is more important than recruitment, because what we should want to be doing is keeping people who are already very experienced and that really know what they're doing and want to work in social care. And somehow we are ending up in a situation where we're pushing out these passionate people out of the roles that they love. I think very importantly, any long-term plan needs to tie together various bits of work that have been going on for years. So we had the workforce survey being conducted in the last few months, results of which are going to come out next year. And that should really inform policy around care workers and how we can support them better. Then we have the pathway, that again, work's been ongoing this year. There was a consultation earlier this year, and how that ties into any kind of reform or long-term plan. And any pathway in terms of career progression needs to really be properly funded. And I think that's the, in a way, of the biggest worry. And it should be in many ways the biggest objective, that we reward care workers properly, which means much better than we do right now, in terms of funding from the national government and what local authorities, how local authorities commission, because I can't really think of a more important job than supporting the lives of others. But while we talk about all of this, there's one thing that we really need to remember, is that care workers are not just tools to deliver care, and that their own well-being and the fact that there are people in their own right with their needs, with beliefs that we should respect as well, that should be at the forefront of our minds as well. I think too often the focus is only on people who draw on care, and care workers are sidelined in terms of activities, in terms of policies. And we do have to remember, care workers have their own rights. They have human rights, they have their religions, they have different backgrounds, and we need to be more respectful, more accepting of that as well, and make sure that they have space to express that and be themselves at work as well. Because we can't expect somebody who has to hide who they are, or who is being bullied for who they are, or who is coming to work hungry because they're not getting paid properly, because local authority is not commissioning enough, to come into work and give their all and deliver outstanding care. So yes, workforce first.
Absolutely, and that is such an impassioned way of explaining what is needed, and I absolutely agree with you. And I was, and that's the nub, isn't it? It's funding. That's fun. It's the funding, and I'm glad you mentioned it at the start, to be honest, because it's all very nice words, and we've heard a lot of these nice words before. And actually, it's coming from really people that we really respect. And Skills for Care, absolutely a great place to start with. But it is that engagement. That's why I thought it was good to see that both Ona and Sir David also said that they think that's important to have people's voices, but it's all the voices. It's not just the voices of people who are supported, although they are the centre of why we're here, but it's that if you like, that relational autonomy of looking at who the other people who enable people to live the lives that they want to live. Thank you for that, Carolina. And Melanie, I know you've had connection issues, so we'll give it a try. Are you okay to introduce yourself and give a few pointers of where you think the direction should be going with the workforce plan?
Hi, my name's Melanie Weatherly. I'm the chair of the Care Association Alliance, which brings together local care associations across England. I'm not sure we need another workforce plan. We need some workforce activity, please. So if we are going to have another plan, bringing all the existing plans together and maybe giving it the government stamp of approval, please don't take too long to plan it. Can we have some action, please, is my first plea. And secondly, I'd echo what other people have said. We need to present social care as I wouldn't even say a single career path. It's a collection of careers, some of which can be the most fulfilling careers in the world. But if you don't know about them, you can't follow them. And obviously, I've seen in the chat someone's mentioned it's not just about older people. Supporting working age adults to live, in Clinton's words, gloriously ordinary lives. Is there anything better than doing that? There isn't. There is no better job on earth. But just because it's a good job and it's fulfilling doesn't mean to say that we should exploit our workforce by not paying them properly. We absolutely need to invest in our workforce, but to invest in our workforce, those of us who deliver statutorily commissioned care need to have investment in that care. Society needs to have a conversation to look at what exactly is social care. Is it worth having? If we want it, it should always be provided by people who are skilled, committed, most importantly, the right person to support the individual that is having support. But if you're going to do that, it's not cheap, and it can't carry on to be being bought on the cheap. You know, if you're working in home care, if you have a service user who would like you to go to them at 8 and finish at 9, and your next service user really would like to stay in bed until 10, you can't do anything else between 9 o'clock and 10 o'clock. You can't go home, you can't do a second job. So is there not a different way that we should be commissioning the care and commissioning our workforce to really, really value it? Or actually admit that we don't value social care, because as a society, I don't think we do. Actions speak far louder than words. We talk about it a lot. Or actually sometimes government and opposition ministers don't even remember to talk about it. So we absolutely need a single workforce plan, but it has to be properly funded. We cannot carry on doing this on the cheap. It's not fair to our workforce, but most importantly, it's not fair to the people that our workforce do their utmost to support.
Thank you so much for that, Melanie. That was really good. Great points that you put forward there. And I actually want to go forward and bring up one of those points and about commissioning. Obviously, I think commissioning should come into the workforce plan. There are the list of things that the NHS workforce plan has in it, which we might revisit. But I think there is some space, I think, that needs to be given to the fact that the NHS and social care are very different. So whilst the two plans do need to almost somehow talk to each other, they do need to address different things in different ways. One of those ways that's different is about commissioning. So from a provider point of view, George, I wonder whether you have found providers having issues with commissioning in certain things that might have come out and which would be good to address in the workforce plan for social care.
I think at a very high level, there needs to be a bit of a shift in terms of narrative, and to borrow a phrase from my chief executive, we need to now focus on shifting the dial in terms of commissioning towards commissioning based upon outcomes now, as opposed to getting lost within the current bureaucracy of both local and national government that so oftentimes does characterize both of those respective bodies. In terms of commissioning, I think the big one for care providers up and down the country, and I don't want to monopolize the conversation around pay, but I suppose pay is the biggest commissioning pressure and the biggest cost pressure for care providers. So despite workforce pay representing the standout cost pressure facing providers, low levels of pay for care staff are considered to be the biggest barrier to recruitment and retention. So increasing the rates of pay is typically perceived by care providers to be the number one thing that would have the most impact on improving the workforce situation. But as we all know, the adult social care sector's ability to be able to adjust wages is extremely limited by the current underfunding which characterises the sector. So care providers' fees are fixed with local authorities and reviewed annually typically. So fee reviews with local authorities are possible, or sort of biannual fee reviews are possible, but are based on needs and assessments and negotiated hourly pay rates. Indeed, increasing stretched local authority budgets, which have been decreased substantially over the last decade, limits the scope for the likes of fee increases, and often there is considerable debate before any increase is agreed. So while the likes of national living wage increases are extremely positive for the sector as a whole and for those who work within the sector, they serve to add to the raft of cost pressures which local authorities are unable to accommodate in their annual uplifts, which leaves providers to make up the difference. So there's a really tricky nuance there in relation to commissioning practice, Sophie, but the pay issue is perhaps the big one in relation to commissioning.
Absolutely. And that was really interesting to hear that is the main thing that's coming out from providers. Not surprising. Great information that's coming through on the chat. Please keep it vibrant going. Thoughts that you've got going through your mind, things that you agree with, things that you want people to talk to. Somebody did actually mention about digital. So we should showcase the amount this is from Voices in Care, we should showcase the amount of wonderful pieces of technology that can support and help the end users to have a better quality of life. And I know that within the NHS workforce plan, there is a section about using digital tech. The funny thing is, there's nothing within the NHS plan about pay. So sometimes, it's interesting that you hear at Care England that pay is a huge issue. I know that Skills for Care have talked about pay. A lot of you have already talked about pay. That plan isn't going to talk about pay. They're talking about digital transformation. So is that the panacea? Is that what they're hoping will get us talking about something else, but not the elephant in the room? So, what is the point in a way? But, and it's actually more of an acute problem in social care than it is in the NHS, I believe. Does anyone in particular, I know, who can I come to for pay or digital? I'm going to start, Mark, with digital. It's good, but it's not going to solve all the problems for the workforce. What do you think?
I think it's all well and good looking at digital, but if we can't attract and retain a workforce, there won't be any digital to use because we won't have anybody to use it. And I think just touching on what George was saying around local authorities, I think all too often all we see is commissioners that are too short-sighted. There's no long-term planning. So actually all we get is these pilots, for maybe 6-12 months, but nothing that actually can kind of allow legs to grow and people to really benefit from services. And I think I hear a lot of providers that are struggling to get onto a local authority framework. And then all we see is actually they then close their doors. The staff that they've employed are then out of jobs. And the majority of those people, whether they stay in care or not, who knows? And I think that's a real worry that actually they have a bad experience of employment somewhere. And they think, actually, what's the point? I might as well just go get a job in a local supermarket or wherever it is else they go. And then we've lost them from our workforce altogether. I think when I looked at the NHS long plan around digital, I thought it was great that it was in there, but I didn't think it really had much substance. There was no kind of longevity. There were no kind of ambition for what that could look like. And I think social care, we're probably further ahead than the NHS in terms of digital, because I think we've got so many great projects going on that a lot of care providers are kind of looking into and trialing and bits and pieces. But I don't think we should place all our bets on digital solving everything. I think it needs to be complementary and go hand in hand. And I don't think we should never get to the point where we're thinking, actually, can digital replace a care worker, which I think all too often, definitely in kind of my day-to-day role, seems to be the conversation that seems to take place, which I'm always the first to argue that actually people are always going to need people to support them, and the digital goes alongside that.
Yeah, some really, really good points. And I want to come back to you, Carolina, about funding, but also about that idea about respect and religion and respecting people for who they are. And there was a lot of talk a few years ago about bring your whole self to work. But then is it something that you're seeing when people do we might have lost Carolina for a second. I'll give it 2 seconds. Okay. I'm going to pass a question to Geraldine, if you don't mind. It talks about leadership and talent management. What kind of leadership and talent, this is in the NHS workforce plan, what do you think the leadership and talent management should focus on? It might be to do with about workforce, making people feel comfortable at work and about their well-being, which I think Carolina was kind of trying to talk to, or it might be something else. If you've got any views on what they should be putting in that section, if there is a section like that in the plan.
Well, there does need to be a lot more attention to look at leadership and talent management and how you help that workforce to grow. And middle managers are often the bedrock of services, and they're often taking on huge amounts of responsibility, both operationally, but also in terms of governance, quality assurance. You know, the regulatory requirements for services now are huge. And there is, you know, we've talked about digital, but there's a need to streamline and align some of that and do that in a digital way so that people aren't having to look through 3 or 4 different sorts of reports or different systems to, you know, update records or to look at activity and to make sure that their services are safe, responsive, all those key things that we expect. But I think this goes back to the training and career development and professionalization, which will help attract, make it more attractive as a career. If we've got, you know, a career structure where you can look at a whole range of different roles, and there are hundreds of roles within social care, within both bed-based care, but community settings for people, obviously from children right through to the other range of the age spectrum, and in sectors, whether it's mental health, supporting people with learning difficulties, older adults, etc. So it's a huge sector. It's a very eclectic sector, but there is a need to maybe develop some sort of training framework, career framework, which goes from entry level right up to senior management level. And so individuals can be supported along perhaps some sort of national framework that recognises certain skills and competencies, and therefore that will help shape and inform the training and investment in training that will help drive that professionalism, but also that can then be a major lever for improving pay and making sure that people get the recognition they need in these key roles going forward.
Yeah, perfect. Thank you for that. And I just wanted to also, you know, thinking about leadership from not only going from the top of being a leader, being a manager, and the support that you need, but also the new talent that you want to bring in. And James, you talked about, and I found that really refreshing, about going to younger people, looking at colleges, not looking at the places that we traditionally look at, people who already have experience. There's actually a lot of people who may be interested in a career in care, but haven't been, not marketed to is the wrong word, but it hasn't been really brought out to those people in a massive way. But I've spoken to some providers who actually, I mean, I work with a college, I'm a governor there, I know other providers who do the same, and there's fantastic opportunities for a new career for them. Can you talk a bit more about why you thought that would be a good idea? Maybe you have some experience in it.
Yeah, I've certainly seen some providers who have had success building those links with the kind of education sector in their area. I think the problem at the moment is that everyone's kind of reinventing the wheel and doing it on an individual basis, whereas if there could be more kind of strategic planning at a government level about how that could be done in the most kind of effective, efficient way, and also identifying what some of the challenges are and how they can be overcome, then I think we would just get a lot further with it a lot quicker.
I just have a quick follow-up question. And actually, Mark's just put in the private chat that I should ask you this. And I'm going to come to then Caroline and then maybe Melanie in a minute as well. And this is the idea about the requirement for employers to provide prayer breaks and lack of flexible working for those who want to go to church or mosques, etc. There's no statutory requirement for employers to do that, but as far as we know, but we should be making adjustments, surely. What's your experience on that?
Yeah, I think that's right. That you would need to be considering adjustments. That applies through to most protected characteristics. Obviously commonly from a disability perspective, but I think also if people, to accommodate. I mean, I think it's essential. I mean, the legal bit is obviously a requirement, but it's probably not on a practical level the most important bit. The most important bit is that if you want to have an engaged and retained workforce, you need to be able to kind of accommodate the kind of individuality of your workforce. And I think that a kind of an extension of that is the kind of the flexibility point, which I think was mentioned before. I think that is, we're certainly working with providers who are trying to be innovative on the kind of flexibility side, and it seems really fundamental. Obviously, there's been a big push from the workforce post-COVID to work more flexibly. That's more demanding in adult social care because of the nature of the frontline roles. But being creative around shift patterns and sharing shifts and creating roles around individuals, because we know that the workforce is predominantly female, and many also have caring responsibilities outside of work, and so the providers that are focusing on trying to create working patterns around their staff rather than this is our fixed set rota, you have to fit in within it, and if you can't, we won't employ you, which is probably where a lot of organizations have been over the last kind of 10 years, because it's in some ways it's easier just to have that kind of rigidity and set pattern. But I think those that have moved away from that are having much greater success from a kind of recruitment and a retention perspective.
That's really interesting. And also, I think that would be good to see some focus on that in the workforce plan. But a reason we're really talking about this is because you brought this up, Carolina, as part of the thought behind in your introduction that we need to pay attention to. Is that because that's some of the issues that you're finding care workers are coming to the Careworkers Charity with?
I think, well, care workers come to us with issues around the financial needs mainly, and also around the well-being. I think what people from cultures that I would call are not white British or Catholic are struggling with is that their needs or their religion, their demographic background are perceived as exotic, let's say, still. And this is, let's have a special day for Diwali at a home or at a service, rather than it being a normal part of life, the same way we all get time off for Christmas or for Easter, and we celebrate it as a whole nation. And it really upsets care workers who have other celebrations to participate in, that it's an afterthought rather than a given, that they have to ask to be able to celebrate rather than for that to be an expectation. And that's where I think the whole thing about bringing your whole self to work to support people, but also bring your whole self to work to be respected as a whole person with your beliefs, with your rights, comes into it. Because for me, social care should not only be person-centered, but should be relationship-centered. But relationship-centered in a way that we respect needs of everybody in that relationship with the same intensity. So care workers are not just there to serve people who draw on social care, but care workers are there to have a good working environment with sick pay, with properly funded pay, where they don't have to go hungry, and when they want to celebrate what's important in their life, or when they want to attend the funeral of somebody they've supported for many years because they are grieving, and they are, that is respected and that is accommodated, because their needs are as important as the needs of people they support. And I think we miss that so often in social care, and that's where I come back to this comparison. I think from the point of view of government, social care workforce is still very disposable. The way for Christmas, people buy an aluminium tray to cook their turkey in, rather than having a metal tray that you wash and you look after so you can use it for many years. I think the same way care workers are perceived. You buy it once, then when it's used up, you dispose of it. And that's why we're losing so many people, because they don't feel like they are respected, they are looked after, they are properly rewarded for the amazing work that they do.
Absolutely. And that's interesting that you're getting that. Obviously, people come to you and they really need the help. But I think
a lot of it stems from the lack of support generally for the sector.
Yep.
And it's not, obviously there will be some bad actors and some, providers not doing things quite right, but generally I think providers try to do the right job, but if they don't have the resources, it's really difficult to do that. I was going to come to Melanie on leadership, but I'm just going to go to you, George, on well-being.
Yeah, I think there is a point to be made in relation to wellbeing, and Caroline has picked up some of the points there. I think from a very high level point of view, if you look at this issue of a leaky bucket and look at the costs of recruitment, for example, the cost of recruiting is on average about £4,000, for example, and then within the first year, the training costs are around £2,200. So if every person you keep within the workforce, you're saving the employer effectively £6,000, which is a huge amount of money if you think about it that way. And with a current vacancy of 152,000, there's something which needs to be said in relation to that point. On well-being, therefore, we need to look at how we can improve the current workforce. And there's a tendency from government actors to gloss over the fact that COVID-19 was a real thing, and it's still continuing to have very real implications for those who work on the front line. So while the financial and social implications of COVID affect us all, care workers were more significantly impacted than anybody else in the country, really, by emotional exhaustion and frustration as a direct result of the valuable work they do in the pressures of caring for some of the most vulnerable members of society. So to support care workers in navigating the wake of COVID-19, employers and government actors need to be considering solutions that help staff build personal resilience and resources that enable a proactive approach to managing mental well-being. But whilst also struggling to deal with the lingering effects of COVID, care workers are also subject to high levels of stress, anxiety, and exhaustion in their day-to-day roles. So without preventative healthcare tools and the likes of in-the-moment support services, the issue of burnout will continue to cost the UK care sector dearly, not just from a cost perspective, but also for those who work within the sector. It's incredibly challenging. So it's essential that care sector decision makers invest in interventions and strategies to address the likes of burnout before its impact is really felt through the likes of employee mental well-being. Caroline has also touched upon it. It's an area which is relatively taboo, but bereavement is a real thing as well. And bereavement is part of the role of care workers, and it's often a very neglected area. So what we need to see is better support and greater recognition of the emotional cost of caring for people, particularly at the end of their lives.
These are such good points. I'm so sorry, everyone. You can hear me typing away. I'm just sending some messages relating to this now. Who's coming next? Right. I'm going to move on to Melanie because I do want to cover the leadership question whilst I still have you. And then I will come to you, James. But Melanie, did you want to come in about leadership and management? Obviously, that's something that the NHS Workforce Plan has brought out, and the Social Care Workforce Plan may or may not. But what would you like to see? I think we've lost her. Okay, James, I'm going to come to you. And I know I've said to people, the panelists here till 1 o'clock, and we have reached 1 o'clock. So if you do need to leave, then that's absolutely fine. But if you can stay on, then wonderful. But hopefully I can come to you, James, on wellbeing.
Yeah, I think it was just a quick point really to add is that I think that there should be a funded occupational health support for providers. I think, on the basis that the workforce, are kind of key workers, and that there is a real challenge around kind of well-being and sickness absence in the sector. And I think that a lot of the majority of the sector is made up of small, medium-sized businesses, which do struggle with the cost of obtaining occupational health reports as a way of supporting, identifying what the kind of health and well-being needs of their staff are, and then being able to put adjustments and support and things in place. The government has talked previously in various consultations about introducing funded occupational health support for smaller employers, but I think that that would certainly be a really welcome part of a kind of workforce plan for social care.
Excellent. Thank you so much for that. Right. I'm going to come to Mark next on wellbeing, whilst we're also on that similar topic. Leadership. No, sorry, you want to talk about leadership?
Yeah, no, leadership, but it also ties into wellbeing. I think we're unfortunately seeing a kind of a mass exodus of registered managers from the sector. And I think, you know, I was a registered manager during the pandemic, and I think wellbeing support isn't there. I think the managers give to their teams, but actually there's very little kind of thought about actually the manager themselves. I think we're obviously seeing frontline pay increase, which is great, and I'm the first to advocate for it. But the kind of the pay as you kind of go further up isn't increasing. So actually that pay gap between kind of your seniors, your deputies, and then the registered managers are slowly getting smaller and smaller. And I can't blame anybody for thinking, actually, why would I want to be a registered manager for a couple of extra pounds per hour for all that extra responsibility, that registration, when actually you could just take, go down a grade to a frontline staff, pick up a few extra shifts, and actually you're probably making the same amount of money. So I think we do need to invest in our registered managers, the same as we are in our frontline staff. But and I think that comes down to succession planning and kind of having those conversations, which I don't think we really do in social care, out of the fear that people will leave our organisations and go somewhere else.
Yeah, absolutely.
Can I just jump in there, Sophie? I think one of the most kind of standout parts of the latest Skills for Care report that I saw was that on average, care workers with 5 years or more experience are paid 6 pence more per hour than care workers with less than 1 year's experience, and that just kind of goes back to Mark's earlier point. But I thought that was a really kind of staggering statistic.
I saw that last night, and I've known it, to be honest. I wasn't surprised. I've been reading the statement, the state of the workforce reports by Skills for Care for years. But then for some reason, I think I'm just thinking, you're thinking about pay increases. You want to give as many increases as you can. And then you just look at that figure and you just think, crazy. It's mad. Because nobody in any other sector would handle with that at all. They just wouldn't. It would just be unions. There's discussion about unions, isn't it? Different podcast, Mark. But there's not enough talk about this crazy situation. Carolina.
Yeah, I just wanted to add about pay differentiation. We monitor a lot of online forums, and actually that's one of the main reasons why many co-workers leave. Then when you have recruitment bonuses that some providers pay, so people coming in new or will offer you a sign-up bonus, co-workers that have been at the organization for a long time, like, well, where is my 500 quid for my loyalty and being here for a long time? And they really struggle with that they're not getting that extra money, but somebody who's just joined is getting it. And I've also seen quite a few posts from co-workers taking in a higher level role for a quid, 2, 3 more per hour. But the responsibility is so much more. They're actually stepping back down because it's not worth it. So the whole pay differentiation thing, especially with the pathway being worked on and coming out next year, I think is one of the most important things, because if we're going to give people expectations that they move up the ladder and they do more courses, qualifications, etc., but it's actually not shown in the pay that they receive, it's going to be very difficult for anybody to buy into a pathway or or believe that there is a career progression in social care if they're only getting a few pennies or £1 extra an hour for a lot more responsibility.
The problem is, I actually absolutely agree with you. The problem is we are talking about the detail, but the bigger issue is about funding, because with all of these changes that are with a plan, you do need funding behind it, because it does look great. And we're thinking the Skills for Care has just been commissioned to do it now. This time next year, we know we're going to have a general election. So there's quite potentially a tight time frame for them to turn this around and do all the consultation and deliver the plan as well, along with everything else that they do. And then what? Is it just going to be used as something for somebody to put on, to promise that they'll do if they were in government for another 4 years or so? And is it something that the department will really take forward going forward? And if there's no money for it, because there's no money in the NHS for pay, so where's the money going to be focused for in this plan if we have the right things in the plan? I wanted to come to you, Geraldine, on some of the points that Carolina was making, or anything else that you were thinking of. I saw you nodding.
Yes, I think, you know, the running theme on all of this is how we value and reward people to stay working in the sector and progressing and having a career that they can see themselves developing in, they can see themselves having a future. So obviously pay, sustainable funding for a pay structure, but also a pay structure that's linked to skills and competencies that people can aspire to or choose, you know, where the point on that structure they feel they want to aim for, with the structure and framework that supports them with supervision, training. You know, that can take the form of many forms, you know, people learn in different ways, but the senior staff who were supervisors or registered managers, middle managers are critical. We need to make sure that we look after them, incentivize them in the right way, both with pay but with other non-pay aspects, because pay is obviously a huge part of it, but also the non-pay side of things is about how you treat your staff, having ethical recruitment practices, but also access to training, both statutory, and additional training, so that people are learning on the job. They feel they're being invested in and being supported to develop in the sector. And there's huge potential in terms of the roles and scope to work in social care. But we do need to look at the pay, but also the progression and supporting people to grow skills, acquire skills, and support the workforce coming in with good mentoring and coaching. Because the other key factor that does affect churn is that people don't feel supported, feel very exposed and under supported, and that leads to burnout and stress because they just can't switch off at the end of the day.
Absolutely. Thank you so much. And I know that we have lost a couple people, and it's not because they're being rude, but like I did say, we did build this for a little bit to end a little bit earlier. So thank you so much to Caroline, who had to drop off, and to Melanie Weatherly as well. I am going to think about closing off now. So if I can come round to everyone with a few last closing thoughts on this. And I suppose one of my last closing thoughts would be that, yes, we're talking about a workforce plan, but the workforce plan works within a system. And do we actually need to define what is social care, what is and what isn't social care? Because it is very different from the NHS. And then we can then work back in terms of how and what we are supporting with our taxpayers' money. Because I feel without defining that, then we are almost talking in cross purposes or trying to ask for more than what this social contract for social care is, whatever that is. So maybe that's a conversation. But also I thought it was very interesting when the video I showed at the beginning, the Prime Minister talked about the NHS when he was introducing the workforce plan, and it was the rhetoric and it was the terms that he used to describe the NHS as something that everyone should be proud of. We should, as a nation, it's something that's so great and so wonderful, which is absolutely true. And I just wonder whether there's a problem in terms of how we describe and how we understand social care again, with how we actually support and fund it and do all of these fantastic things that you have suggested for the workforce plan. So those are just some of my thoughts. But George, did you have any closing thoughts?
Yeah, so I think all of us on the call have likely experienced or heard about the remarkable impact that dedicated social care professionals have on the lives of individuals across the country. And despite representing really the lifeblood of the sector, the workforce, as we know, and as we discussed today, has been afflicted by a series of diverse and sometimes, in some cases, deepening challenges over the past few years. For example, the high turnover and vacancy rate. And what we now require really is a strategy which is akin to that of the NHS long-term workforce plan we saw published earlier this year, but one which not only seeks to address the current issues in the here and now, for example, that 152,000 vacancy rate, the issue of well-being and the other factors we've discussed today, but it also needs to future-proof the sector to be able to adequately meet the needs of a 21st century population.
Thank you so much. Geraldine, I know you have to go. Do you have a few seconds to say a few last words?
Thank you. Yes, I will be going shortly. Yes, I think the overriding message is we need to, provide an offer that attracts people in with professionalisation and pay, but also the opportunity that helps them see that they will be supported and able to grow and develop their careers if they wish to.
Great, thank you so much. And Mark, do you have any closing thoughts on the workforce plan for social care?
No, I think we've kind of spoken about everything. I think the only thing we've missed is kind of unpaid carers and the amount of hard work that they do, but also the backlog that they prevent in both social care and the NHS. And I think without them, actually, I think both sectors would be incredibly different, probably a lot more complex and a lot more kind of backed up than we currently see. So I think whatever that plan looks like, it also needs to be a plan for unpaid carers as well.
Absolutely, and I agree with that. And I think that's where I would like some clarity on what we were talking about when we were talking about social care, because a lot of people would agree that they should be included in any workforce plan because they do work. It's just that they're not paid, or generally not paid for what they do. So thank you for that, Mark. And to you, James.
Thanks. I think my final kind of point would be around integration. That's at the kind of forefront of the kind of political agenda at the moment. And my concern about having a standalone social care workforce strategy is that it won't have the profile, status, or funding commitment behind it that it would if it was a joint workforce strategy with the NHS. I mean, to me, it seems bizarre to have an NHS workforce plan which doesn't also cover social care, because realistically, there's no prospect of the NHS achieving their aims and objectives without having an effective and fully funded social care workforce plan. And I think that if the two were integrated, there would be much more thought around common pay systems, which I think is fundamental, increasing understanding in the NHS about the challenges within social care, looking at integrated roles and competency frameworks and integrated learning and development opportunities as well. And I think it would almost increase the profile, but also kind of hold the NHS and government accountable a bit more because of that kind of intrinsic link between the two.
I know I'm on mute there. So that's a really brilliant thought. Thank you for that, James. And I think that is a good all-rounder, because at the top of it, I did actually show a comment from, I think it was the Nuffield Trust, that said exactly the same thing, that really they should be worked at together. But that potentially is another live stream for another day. So I'm going to carry on for a second just to talk about what Coaprage's Care is doing, but I'm going to say thank you very much to our guests. And if anyone watching now or later, I know most people do watch us later, please do give a thumbs up to the live stream wherever you're watching it, and subscribe, just to say a huge thanks to everybody for coming and joining us on the live stream today. So thank you, everyone, and have a lovely rest of your afternoon. Just going to slowly remove everyone. Give me remove the wrong person. That's not good. Okay, so thank you to everyone who stayed on for a second. That was a really amazing debate, and I really enjoyed that. We want to do more of that. So please do engage with our material, give us some feedback, stay on in the chat. We have been doing a few things in the background, not huge amounts, but we are going to have another live stream for anyone who's just joined us. I'm going to have one with CQC on the 12th of December. We're going to be talking all things CQC, adult social care, with James Bullion. So it'd be really great if you could join that. But if you sign up to our newsletter or if you subscribe, then you'll find out all the information that you need to find. But also we've created a members area on our website. So I'm just going to pull up a little screenshot of that. So on the members area, it's slightly different to just being subscribed. If you are subscribed already, you can inquire about how you get onto the members area. It's totally free, but it's just some more documents that we've been developing. So it's quite small on this screenshot, but there's one about CQC and how they are doing the new restatements and how you might want to evidence them. So we've created a Excel spreadsheet about that, and also a digital spreadsheet around digital transformation. So what good looks like. There's a new initiative and guidance from the department on how to really best practice in using digital technology. So we've created a web Excel spreadsheet which you can download from the web page, the members area of our web page, and it just enables you to see what they say good looks like, and then comment on how you're meeting those standards. Give yourself a RAG status, put some comments behind it. Maybe you want to do some of the changes in a year's time, in 5 years' time, for your organisation. And I'm going to just move on to some of the other stuff that's on there. We're trying to do a summary of what outstanding elements from CQC reports are. So we are just collating a summary of those every month. So we've done one for September, October one we're going to do hopefully in the next week or so, and we're going to pop that all on our members site as well. And just a bit of a snapshot of some of the spreadsheets, what they look like. It doesn't look very good on here, but it's really operationally it's supposed to be helpful for people. So that's the digital one on the framework for what good looks like. And this one here is for CQC's new inspection framework, and it really does help people to understand, see what the restatements are and put in their plans to meet the restatements, and also some impact stories. I thought it'd be good on any Excel spreadsheet to encourage your managers, people who are being supported, to really put what impacts the things that you are doing has on them, because sometimes it's easy to just list what you do but not really discuss what that means to people. So we put that down, so when you do have, not just for an inspection but also just to really think about what you're doing, and is it enough, is it good enough, should we be doing something different, and just make it a little bit more in depth. So a huge thank you to everyone for staying with us and listening to the live stream. Thank you for your comments and getting involved today. And we hope to do another one, like I said, in December. If you want anything else and you're happy to email us, then we'll try and do some more. But at the moment, we're just going to plan for that one. The ask for the one in December is for, if you are on our mailing list, we will email you the Eventbrite and we'll be asking for your questions for the Chief Inspector, because really, we only want to ask your questions to him, but we have to submit them to him beforehand. So if you do sign up, we'll send out some emails shortly and invite Eventbrite, and in that we'll be asking for what you want to be asked. Some people have already told us, which has been great. Things have moved on. Obviously, you might have more queries or different queries now to what you had before. So I'm just going to ask you to get in touch with us and sign up to our newsletter. So thanks everybody so much for joining, and I'm going to sign off now. Have a lovely rest of your evening, afternoon, whenever you're watching us. You can watch back on this stays on whichever platform you're watching us. Encourage other people to watch, share it, like it, and of course subscribe. So thank you so much everyone. Take care.